Sir, what is constipation, sir?
Constipation in general described as infrequent passage of stools and hard stools being passed. So there is, in children particularly, there is no fixed time limit or frequency for passing motions. Some children are comfortable passing stools once in 2 days, and some children are comfortable passing 3 times a day. But average, especially when the children are a little older, for 1, 2, 3 years, by the time, especially when they're school going, we want the stooling pattern to be normal. That is, at least have 1 or maximum twice a day, so that socially it is very acceptable.
What are the common causes for the constipation, doctor?
Common causes for constipation are, we'll put it in 3 ways. 1, it can be medical causes. Number 2, it can be surgical causes. And third, most common is habit constipation or a functional constipation.
What are the medical conditions for constipation, doctor?
Commonly, the medical conditions for constipation is hypothyroidism. Whenever the thyroid hormones is less, it comes. Previously, it used to be very common, but nowadays, most of the centers who do thyroid function tests at birth, particularly TSH, and most of the times thyroid profiles are taken and are eliminated. However, as the child grows, most of the times our pediatrician will be able to identify common symptoms of hypothyroidism like excessive weight, slow mentation, poor schooling, etc., by which they will be able to identify.
Which are the surgical causes, sir?
Good. There can be surgical causes for constipation, that's why we surgeons come into picture. The surgical causes for constipation actually varies from age to age. For example, if the child is constipated since birth, that means there can be some anatomical problems. For example, Hirschsprung's disease, in which there is a little disordered innervation by which the bowel loops do not relax and the constipation is present almost since birth. Children have abdominal distension, have failure to thrive, not gaining weight, and may also have frequent bouts of unexpected diarrheas. This is present since birth. However, sometimes anatomically the anal opening may be smaller. In such cases, the constipation manifests a little later. For example, by around 3 to 4 months of age, when the weaning starts, that means the stool becomes softer. From softer, it becomes harder, and that's the time when constipation may get unraveled. However, the most common cause of constipation is a functional constipation.
How to diagnose this problem in the early stages, doctor?
Yeah. When a child has a constipation, pediatricians generally rule out the medical causes and send to us. As I said, it requires to have a proper history. That is, the child is passed stools on day 1 or day 2. Generally, it rules out that Hirschsprung's disease that we said. If the child has no abdominal distension, he is able to pass flatus well, and is already having a good, fairly acceptable stooling pattern in the first 1 year of age, it rules out Hirschsprung's. However, if the child says that they have problems in which child is passing hard stools, paste-like stools, difficulty, yes, it can be because of local strictures, local narrowing of the anal canal, for which again a surgeon will be able to pick it up on medical examination or a clinical examination when the child comes to us.
How the parents will come to know about these problems, doctor?
Most of the parents will be able to identify that the child has an abdominal stooling pattern, does not pass stools every day, has a little abdominal distension, and most importantly, many of them, when they present with constipation later, they present with recurrent abdominal pain for which they are not able to identify a cause.
What are the commonest causes we see in the constipation, doctor?
The commonest cause for constipation in children is functional constipation or habit constipation, that is improper food intake. Unfortunately, it has now become a worldwide pandemic, much worse than even COVID, because the bad eating habits of the Western world has fast caught up in India, and previously it used to be only affluent classes. Now we see even smaller households, rural households, semi-urban rural households also tend to have constipation.
What is functional constipation and what is habitual constipation, sir?
In general, functional or habit constipation that we call is because there is no structural cause for a surgical one or a medical cause like a hypothyroidism. Most of the times it's because of bad eating habits. Now it's become the norm. Because they tend to eat a lot of this junk food and they don't eat adequate amount of fiber, so they end up getting constipation. This is the commonest cause and has now become, as I told, a pandemic across the globe.
How to avoid this, sir?
Constipation is because of, in these children, is because of 2 reasons. One, because the parents are overindulgent and tend to give the child whatever it wants. All the child requires to do currently and everybody has got only 1 or 2 children, and everybody is so doted towards their children, they tend to listen to what they say. All that requires to do is a little cry from the child, a little strike from the child, and the parents tend to give what the child feels, quality, timing, quantity, every single thing. Obviously the child takes whatever is tasty, easy to take, and whatever pleases the child most. So this need not cover good food.
What are the dietary precautions we can take?
Yes, 2 important things has to be balanced out. 1, all junk food to be avoided, and number 2, make sure that you are going to give fiber rich food. When we say junk food, there are 2 types of junk food that I would like to say. One junk food is very obvious. Any bakery products, bread toast, pizza, burger, noodles, Cheetos, Kurkure, Nachos, all the brothers and cousins who all come well clothed. That means they are all very well packed, available in malls, and they are available in bakeries. Packaged items bought from a store is junk, obviously. Apart from that, there are a lot of other, especially South Indians, we tend to eat this chakli, kodbale, puri, kadle puri. All of them do also tend to have a fiber. Basically, what we are talking about is the imbalance. For example, I offer you a packet of chips. How many chips you are going to take? 1, 2, maybe half packet, not more than that, unless there is some occasion, party, etc. Children don't tend to do that. What they do is they finish off the entire packet of chips, which has a stomach which is approximately 1/4 or 1/5 the size of a stomach. That means a child eating 1 full packet of chips is equivalent to you eating 5 packets of chips. Now tell me, once you eat 5 packets of chips, how comfortable and how happy you will be. That's exactly what they happen. Children tend to choose what they want and they refuse to take other things, and we as indulgent parents agree and allow them to have it is the main problem.
What are the dietary changes we can implement during this problem, doctor?
Yes. As I told, 2 things. 1, you have to completely avoid fiber, at least for a month or at least for about 2 weeks, so that the child gets used to food without junk. Number 2, you have to increase the fiber. There are 2 types of junk. One junk is obvious junk. That means all the bakery products, all the packaged items, all the processed food, almost all the things which do not have any vegetable fiber are junk. Apart from that, there is another type of junk which people don't really understand. These are the things with any even Indian diet that we tend to have without any vegetables or fruits. For example, you're going to have chapati with sugar, dosa with shakkar, dosa with ghee, idli with chutney. Okay, tell me, where is it? Masranna, curd rice, rasam rice, where is the fiber? So the point is, all these things also tend to become like a junk. Point I'm saying is, it's okay to have any of these, provided you have enough amount of fibers. So, child, if you tend to ask, sir, Kortiv sir, we get to give a little bit of vegetables, we give a little bit of fruit juice. No. Let me point that the junk food are these. 1, any food without any fiber is a junk. That means any food which does not have vegetables or fruit is a junk. That means fruit juice, yes, it has nutrients, but has got no fiber. Any amount of all these processed foods, yes, they have some sort of energy which the child is happy, some taste the child is happy, but no fiber. As I told, other things which we tend to normally give for children, see, any child who is less than 1 year of age, it's fine to have special diet. Like I want to have Cerelac, we give ragi cereal, something, it's fine. But child at 1 year of age should be able to take whatever the adults take. The quantity may be less, but the proportion should be the same. That means the child should be able to take vegetables and fruits and everything. Almost all the native Indian diets across the country and perhaps across the world was okay, till such time the Westerners came and influenced us. Now our rice is polished, no fibers. Now our sugar is refined, no fiber. Now all the food that we tend to have is all processed food, again no fiber. So all of them actually tend to become quite unhealthy, and this is the main reason why we get in. So if you're going to treat your child, please understand, stop all bakery products for now. I'll tell you when to give. Stop all bakery products completely. Stop all the things which does not have vegetables and fruits. For example, if you're going to give idli, make sure that there's going to be a sambar or something with vegetables. If you're going to give chapati or puri, make sure that there's going to be sabzi with vegetables. If you're going to give uppitu, upma, make sure there is a lot of vegetables. Even if you think you want to put noodles, put a lot of vegetables. Okay, one word of warning, When you're considering vegetables, don't consider potato, aloo as a vegetable. It has got starch and it has got no fiber whatsoever. It's okay to give, but don't count it as a vegetable. Okay? One. Number two, make sure that we're going to have no junk food, obvious and not so obvious. Two. And any food the child should have vegetables and fruits. The simple thing about it is, at least till the child gets all right, the general pattern of feeding I suggest is like this. In the morning, whenever a child gets up, make sure the child has a stool. Once that is over, come back and whatever your house, want to give milk, juice, coffee, whatever your house, I'm not going to come in the way, give it. After the breakfast should have a big bowl of fruits. Fiber rich fruits. For example, sapota or chiku and apple do not have enough fibers. So any other thing, seasonal fruits that you have, yes, banana, papaya, mango, guava, whatever. You don't need to go for exotic foods like kiwi, zucchini, but even if you're going to have simple, locally made produce, make in India, Atmanirbhar. Okay, it's good. So unless the child has one bowl of fruit, no tindi. Once the child has this, then the food gives. No fruit juice. Make sure that the breakfast you give will also have enough amount of fibers. I told you, like put some palya, put some vegetables. Make sure that there's some other preparation which has some vegetables. School short break should have either a fruit break, don't call it anything else, or a salad break. Make sure that you're going to get cut fruits to send it. Don't send this bakery products because of it is easy. It's not going to help. Afternoon lunch, night dinner, make sure the child has got one big bowl of vegetables. It can be raw vegetables like salad. It can be the palya that you have made. You can make vegetables, boil it and sprinkle with a little bit of ghee or make it tasty by caramel or something. Something is fine. Unless the child has these vegetables, no meal will be given. But most important, make sure your child does not have any feed in between. Okay? If at all, when the child comes back from school after lunch, by evening you want to give some high tea, something, yes, maybe with a little biscuit, some milk, coffee, whatever juice. Other common causes for constipation is also excess amount of milk, especially in small children. They say I give 2 liters of milk a day. As I told, 2 liters of milk a day for the child is equal to you taking 8 liters of milk. Can you imagine after 8 liters of milk how much stomach capacity you will have? So make sure that you're going to reduce the milk also. So no feed in between the breakfast, lunch, high tea and dinner. Only these and nothing else in between. Apart from this, another important thing is no distraction when feeding. That means no eating in front of TV. Okay, so what happens when you're eating in front of TV with phone, with mobile, WhatsApp, iPad? Your concentration gets diluted and you're not able to eat what you're supposed to eat. So best thing is I would say, sit with the family, switch off the TV, switch off the mobile, sit, talk with the family. It also increases the bonding and then eat well. Strictly no snacking in the TV hall. Cricket match is going on, let me munch something. By the way, all that I'm taking is telling you is good old habits which you were inculcated by your parents and grandparents, right? If you look back, that's how we also grew up. So all I'm saying is to reinvent that. And incidentally, all the things I'm talking about is applicable to the whole family. It's not for the child. All right. And next, you're going to ask, sir, how is it possible to be denying my child for noodles or pizza, burger, McDonald's? He also should have. Yes, agreed. It's after all our child. Why should we deprive? Fine. But that should be exactly the way we most of the time take. That means it's once in a way. For example, the entire week the child listens to what you say. One day a week, listen to your child. You're going for a party. Yes, enjoy. You're going for a movie. Have any bit amount of popcorn, noodles, whatever you want, pizza, burger. Yes, once in a way, but not on a regular basis. If you can do this, most of them come back. And many times when people say, sir, I'm giving vegetables, I'm giving fruits, but the child is not. Please understand, it's not a half-hearted effort, it's a full-hearted effort to make sure that the child has good amount of vegetables and fruits. In simple words, if you look from S.P.S. and Nagaratna madam, she says, yoga expert, tea, tatte, tumba, tarkari. That means half the plate should be vegetables ideally, if not half, at least 1/3 of it. Unless you have enough amount of vegetables, it doesn't come. Perhaps a major reason for this constipation is because of Westerners. You look back at US or UK, Most of the times they eat all the pizza, burger, etc., etc. Let me assure you one thing. The malnourishment and obesity in US is maximum amongst poor and blacks. Why? They tend to eat pizza because that is cheaper than the conventional food that we get. So the poor get the disease there, the rich get the disease here by paying more. Vegetables and fruits and healthy foods are expensive in the West, whereas here they are cheaper. So we do want to get into those diseases. The other question that you ask is about, sir, rural households, semi-urban households, children of parents. I mean, they can't afford these things, but still they end up constipation. Children of construction worker. That's simple, because when they go for work, children are crying. The easiest they can give is give one packet of picnic or chips or something. You keep eating, I'll come back. So perhaps this is a reason for which it is sort of percolating amongst the poor and is now soon becoming a pandemic. Unless we are going to do it, it's not going to come. I think even PM Modi has been making that very clear. India is going to end up with a big load of malnourished people, overweight people. This is perhaps because of the bad eating habits. If you're going to regularize your food intake, make sure that you're going to take it on timely intervals. Make sure you're going to cut out on fat and oil and exercise well. We can make sure that this obesity, a pandemic which is looming large in the country, will come down. Because again, this is going to have two issues, far-reaching. One, if the body is designed for 100 years, it is 100 years designed for sake of your conventional body size. If you're going to increase your body size, that means you're using up resources. So if a family has a history of diabetes, you will get sooner than them. If a family doesn't have diabetes, you will definitely get it. If hypertension is there, it will come. Lots of lifestyle diseases are linked to obesity. Most of the adult obesity is linked to childhood obesity. So unless you put this sort of discipline in your children, they are likely to have more issues which are completely avoidable. Apart from this, obesity epidemic across the world or across the country is going to be costing us millions of dollars. So in any which way you look at it, I think inculcating proper eating habits among children is a foremost responsibility of the parents. Please understand, one more issue that happens is about the indulgence of the parents and the grandparents. Parents, most of them are working both the sides. So when they come home, they feel the child is not there. Yo, papa, child is alone and not taking. So first thing they do is to indulge. Array, take this and take that. And most of them are basically junk food which we tend to give. This I think we need to avoid. Because love does not mean giving child everything that the child asks for. Love means give the child what it needs to be given. One. Most important responsibility that we have to make sure is the child gets a discipline. That means a discipline means saying what I want and what I do not want. Just because child demands everything, if you keep on giving, the common phrase is they will win at home but lose outside. But if you discipline them, they may lose at home in the beginning, but they will win long time. So if you have, as parents, it's our bound responsibility that the child develops a discipline and to make sure that the food discipline is taken care of so that the entire lifetime for the child is alright, and do not substitute love with all these junk food. The other common cause for the problem is nowadays we have lesser children and the more amount of doting people at family. There is an uncle coming, grandmother is there, grandfather is there, neighbor is there, everybody tends to give something. Okay, and this goes unaccounted. So the best thing is there should be only one person in the family who is going to feed the baby. Every other person who comes, which should be given to the parents, keep it in a transparent box, give it to the child, but you decide when to give, how much to give. It's not that they're going to indulge. If the parents, grandparents say, tell them, don't worry, I'm disciplining my child, don't spoil them. Okay? And even amongst parents, I think we should have one voice. Another common problem is about multiple parenting. One child tries to discipline, others tend to say, it's okay, ivat kotpudu, from tomorrow. That doesn't work. If one parent is disciplining, I think everybody has to be in sync. Whether it is uncle, aunt at home, grandparents, father or mother, either the case may be, make sure that the child gets disciplined and should be able to have healthy eating habits. Because I think this is the biggest gift you're going to give to your child for lifetime.